Let's talk about something that's frankly pretty scary, but also super important to know: a dog bite. It can happen in a flash, and honestly, what you do in those first few minutes can change everything. Knowing the right steps isn't just helpful, it's absolutely critical. So just imagine it for a second. A dog bites you. What is the very first thing that pops into your head to do? Now, a lot of us think we know the right answer, but in that moment of panic, the single most important step is so often forgotten. We're going to make sure that doesn't happen to you. Okay, first things first, we have to understand exactly what we're dealing with here. See, a dog bite isn't just a simple cut. It's a complex injury. You've got the immediate, obvious damage, of course, but there are also all these hidden dangers lurking just under the skin. Right away, your body is going to sound the alarm. You'll obviously have pain and redness, that's a given. But you really need to watch for swelling. That's not just a simple reaction, it can be an early warning sign of infection setting in. And depending on the bite, you could be looking at anything from a tiny puncture to some pretty serious tissue damage. And if a nerve gets hit, you might feel that weird tingling or even numbness. So that's all the stuff you can see, but the real reason we have to take every dog bite so seriously is because of what you can't see. And we're talking about two major invisible threats: infection and the big one, rabies. Here's the thing you have to understand. A dog's mouth is just teeming with bacteria, so when its teeth break your skin, it's like it's injecting all of that bacteria deep down into the wound. This is exactly where the most serious complications come from. And one of the nastiest bacterial threats is tetanus. This stuff is often found in dirt and animal droppings, so a deep puncture from a bite is like a perfect open door for it. It gets in and attacks your nervous system, causing these awful muscle spasms, which is why people call it lockjaw. Now, the good news? It is totally preventable with a vaccine. That's why your doctor will always ask when you had your last tetanus shot. And now we have to talk about rabies. And there is just no way to sugarcoat this, you guys. Once the symptoms of rabies show up, it is almost 100% fatal. There's no cure. The only way to treat it is before you feel anything, which means that every single decision you make after you've been bitten is quite literally a matter of life and death. Okay, that was the heavy part. Now let's get to the empowering part. Because in those first 15 minutes after a bite, you have an incredible amount of power to lower your risk of all those bad things we just talked about. These are the steps that can get you on the right track right away. Listen, if you remember only one thing from this entire explainer, please make it this number: 10 minutes. That is the absolute bare minimum amount of time you need to be washing that wound with soap and running water. I'm not talking about a quick rinse. I mean a serious, thorough cleaning that physically flushes out bacteria and virus particles. It is the single most important thing you can do for yourself. All right, here's the full playbook. Step 1, like we just said, wash it for at least 10 minutes. Step 2, if it's bleeding a lot, grab a clean cloth and apply firm, direct pressure until it stops. Step 3, once it's clean and the bleeding is under control, put some antiseptic on it. And finally, step 4, cover it up with a sterile bandage to keep any more junk from getting in there. Simple, effective, and you can do it immediately. And I really cannot stress this enough. First aid is what you do on the way to the doctor. It is not a substitute for seeing a doctor. Every single dog bite that breaks the skin needs to be looked at by a healthcare professional. No exceptions, period. Okay, so you've done your first aid, you've made it to the clinic or the ER. What happens now? Let's kind of pull back the curtain on the process so you know exactly what to expect when you get there. So, once you're there, the pros take over. First, they're going to assess and clean that wound way more thoroughly than you can at home. Then, they'll ask about your tetanus history and probably give you a booster just in case. You'll almost certainly leave with a prescription for antibiotics to head off any infection. And then, the most important part begins. They'll start assessing your risk for rabies. So this is the million-dollar question, right? How do doctors figure out if you actually need that whole series of rabies shots? Well, it's not a guess. It's a really careful evaluation that's based on a few key factors. This chart lays it all out. The risk goes way up if the dog is a stray, if it's acting weird, or if you just can't find it to keep an eye on it. The risk is much lower if it's a family pet with all its shots, and it can be watched for 10 days to make sure it doesn't get sick. The takeaway here is huge. Any information you have about the dog is incredibly valuable for your own treatment. If the doctor decides the risk is high enough, you'll start what's called post-exposure prophylaxis. On day 0, the day of the bite, you'll get your first vaccine and a shot of something called rabies immune globulin, which gives your body an immediate head start. Then you come back for more vaccine shots on days 3, 7, 14, and sometimes 28. Yeah, it's a commitment, but this treatment plan is pretty much 100% effective at stopping rabies in its tracks. We've spent a lot of time on what to do after a bite happens. But now let's talk about the best strategy of all, how to avoid getting bitten in the first place. And it all comes down to one thing: awareness. It's your single best defense. You know, dogs almost always tell you when they're uncomfortable long before they bite. You just have to learn how to speak their language. Growling is pretty obvious, right? But look for the quieter signs too. A body that suddenly goes stiff and still. A tail tucked way down between its legs, that's fear. Ears pinned back flat against its head, or when you can see the whites of their eyes, sometimes called whale eye. If you see any of that, it's a signal to just back away slowly and give them space. Now, this is so important because it goes against every instinct in your body. Your brain is screaming, run. But running can actually trigger a dog's natural prey drive, and that can turn a warning into a chase. The best thing you can do is stand still. Be a tree. Be boring. You become much less of a threat. Just protect your face and neck and do not run. And this chart is a perfect summary. The do's: stay calm, be still, and avoid staring a dog down because they can see that as a challenge. The don'ts: don't run or scream, don't just walk up to a dog you don't know, and definitely don't bother a dog when it's eating or sleeping. Following these simple rules of etiquette can help you steer clear of most bad situations. So there you have it. We've gone through the immediate impact, the hidden dangers, the critical first aid, what the doctors will do, and finally, how to prevent it from ever happening. You've got the knowledge now, so the only question left is, if that moment ever comes, are you prepared to react?